Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing.
This gentleman's come through from using Q-tips to try and clear his ears, but he's actually impacted the wax. You can see the depression in the centre there of the wax, and the fact the wax is spread out to all the canals. So that's a really good indication, a clear indication that Q-tips have been used. So what happened with this gent, he'd felt that his ears were getting a little bit blocked up, used Q-tips on both sides to try and clean them, as what's actually done is pushed the wax very, very deep into the canal, and then carried on using the Q-tips to try and see if he could get the wax out just through desperation more than anything else. And what you'll see is that it's really dried up, compressed together, so that's what they call impacted, when it's all squashed together and hardened up. So what we can see here is we're trying to work on the base of this wax. Obviously, if we go straight to the centre, this wax around the outside edge is going to hold everything in place. So what I'm doing first of all is just very gently lifting the wax from the canal wall. Now, normally with wax that's this dry, we pop a little bit of olive oil in there to try and help to loosen it. But the difficulty when you put olive oil in, especially when you're trying to work close to the bottom of the canal here, is gravity's going to pull the oil to the bottom of the canal. So what you're going to end up with then is a very poor visual of where the wax ends and the skin of the ear canal starts. So what I prefer to do is just to try and lift a little piece first of all. That just gets everything off the canal wall, so I've got a nice prominent piece to work on, but also it allows some of the olive oil to work underneath it, so that the way then you get this reduction in the stickiness really of the wax around the outside edge, so it makes it a little bit easier to remove. So what I'm doing now is I've sprayed some olive oil in, we've got it underneath, we're just working around the top edge now, okay, just trying to peel that away. Obviously all these edges that are quite prominent and closer to the outer part of the ear canal are going to hold this deeper, far more impacted piece in here. So what we're doing now is going back to the bottom section, still using the standard size ulnar tube at the moment, just to try and lift, trying to get a big enough gap for the crocodile forceps to get underneath. Now with this kind of issue, sometimes we're lucky and the whole thing will hold together really nicely, so when you hold onto it with the forceps then it will pull the whole thing out. But what we can see here is it's very crumbly impacted wax. So although we took a piece away there with the forceps, you can see it's just broken that kind of more prominent edge off. There's a slight gap here at the top, so we're just going to see if we can get the forceps underneath. You have got a leading edge coming away from it, you can just see it there, but it's quite flat just below it. So what happens then is it's difficult to get the kind of the jaws of the forceps over that flat, because the flatter section will stop the bottom jaw from getting in far enough. So we've gone back to the standard size ulnar tube now, just trying to find any looser section of this wax, trying to get any kind of purchase we possibly can onto this wax. A little bit of olive oil there from the Scylla on the camera, so we just cleared that away. You can see we've got a slight gap here at the top, so I'm trying to work that gap and pull it down. Can you see just how thick and hardened up though the wax is? So Jobson horn's going to go in. Though we can't go too deep past the edge of this wax with a Jobson horn because we are very close to the eardrum. You can see just how tough that is. So I'm just literally just working above it, pulling down. I want to try and break some away. There we are. So it gives us a little bit of wax to work on. Now if this wax was further towards the outer part of the ear canal, then we could possibly use the St. Bart's hook here. But because it's still very deep and very close to the eardrum, you're going blind behind that piece of wax. You can see we'd have to go right the way down to get behind it. It would be the perfect tool if this was further out, but because it isn't that, it's got a bit of it's very close to the eardrum. If you go pushing the St. Bart's hook down there, it's just going to end up touching the eardrum, or worst case scenario, perforating the eardrum. So we've administered a little bit more olive oil in here just to try and loosen this wax, just to try and take it away from the canal walls, but also to help us get a better suction grip on it. It's really firmly wedged. It's one of the worst types of wax to remove is if somebody's really gone at it with Q-tips, because it compresses the wax together, the wax dries out, it ends up being pressed really deep, which means you don't have a lot of room to maneuver. You're limited with the tools you can use to remove it, and it's in the most sensitive part of the ear canal. So this is, this part of the ear canal, to remove wax from here is really difficult, not to cause the patient any kind of discomfort, because you're working almost against the eardrum, against the canal walls the whole time. So you've got to be really, really gentle in this section. Just trying to lift this bottom part of the wax up. What I'm aiming for, where the wax has been pushed against the canal wall, we know then the bottom of the wax is going to be quite smooth, but also it should help us to get a good grip. So if we can lift it, you can see just trying to use the forceps there to get underneath, but still can't quite get under that piece of wax. If we can lift it to get that smooth section exposed, then we can get a really good suction grip on that section. So I'm just doing some very gentle maneuvering of the wax, just wiggling it back and forth, trying to pull it out of that section. So we've got a bigger kind of edge there now, so I'm just going to see if we can get a grip on that with the forceps. But you can see as soon as that top kind of jaw of the forceps comes into contact, it just pushes it back down into place. So we'll go back in again now with the suction tube to try and get a good grip. Gently wiggling. You can see it's coming forwards now, which is good, because it means we can then see if we can get above it slightly or lift it slightly. There we go. Now we're getting a bit of movement to it. You can see just how dark this wax is as well. And there we are. There's the eardrum. So we've managed to expose that side. So when we take a look at the other side, you can see exactly the same thing on this side. So that very deep depression in the center of the wax, all the wax coating the canal walls around the outside edges. So another classic Q-tip use. This wax doesn't look as hardened up as the other side. It does look a little bit thinner. So we're just going to try and see if we can lift any of this wax. It's really difficult when the wax is this thin, because you are working very, very close to the canal wall, which can cause pinching, scratching sensations in the ear canal, which can become quite intense if you're doing this very deep in the canal as well. Just slowly working our way around, looking for any leading edge that we can get the suction tube, just sort of scraping along the canal wall, really. So we've moved on to a different spot. There's nothing really giving at the bottom. There, we've managed to break a piece off there. You can see now working at the top, just slowly working our way around here to see if we can get any grip. We've managed to loosen a section to the top right corner there, you see? See it peeling away from the canal wall. There we are. I get a better view now the sill has moved out of the way. Okay, so we've got quite a flat section there. But you see what I mean about it being much, much thinner, which in some ways is a little bit more difficult to remove, because you tend to find this very thin wax, this tends to be really stuck to the sort of canal walls. You see we're starting to get a bit of movement there to the top, to the bottom, so everything is starting to peel away a little bit. So we're going to try the forceps on this one. Sometimes we'll be lucky and it'll all peel away. Just putting some gentle pressure, you can see just tore straight through the middle of it. So we're just going to try again. It's just because it's so thin, it's not really got the kind of the integrity in the wax to hold it together. So it just means it's just kind of tearing and pulling apart there, unfortunately. A couple of little hairs embedded in there as well, which is complicating matters a little bit further. So going to go back to this this edge we've created on the left hand side, see if we can break that away a little bit. We've got one piece that's jutting out quite a lot, which is going to be interfering with the suction. Okay, so every time we try and go and move to a different piece, this little piece here is blocking that suction, so it's just stopping us from getting a good grip. We've administered a little bit of olive oil. You can see the difference the olive oil makes. See how that's peeling away now from the bottom of the canal wall? You're getting these kind of bigger strips. It's just loosening off. There we go. We just got stuck in the outer part of the ear canal, so we'll just get rid of that piece there. Okay, so back to that top section. You can see the oil's actually coated this this piece of wax at the deepest part of the wax there. Now you can see everything is starting to peel. Okay, so we're starting to be able to take this away now. A little bit of olive oil on the camera again. Just very gently trying to pull this down off the eardrum. You can see it's just how impacted and how stuck down this is. So crocodile forceps going in now. We've created a bit of an edge, so let's see if we can get a grip. Not quite. Let's try again. There's one piece at the bottom that was getting in the way, so we're just going to take this away. There we go. Still a little bit of it there, so we're just trying to get rid of that now with the suction tube whilst pulling on this top section. When the wax is this deep, it's never going to come out with drops. I mean, we get a lot of patients who have used drops to try and remove this. The mechanisms for expelling wax aren't found this deep in the ear canal. It's all the outer 2/3 of the canal, really. So when it gets to this stage, and when it's really impacted like this, there is no way you're going to get this out without having it sort of manually taken away. As we pulled that section coming away, did you see it start to loosen the wax behind a little bit? So we're just going to see if we can grab that top section there. You can see a little bit of movement to the wax. See, the whole thing is one piece, really. It's all just moving as one section. So we're going to use the suction tube now just to go in. I'm going to aim for a slightly different spot. Now, sometimes you aim further back from the canal, you'll get a nice pull on a long strip, a bit like what we got here. If you're lucky, that will lift the base out a little bit of this groove at the bottom of the canal. But it hasn't happened, so we're just going to... There, now. Can you see the whole thing's lifted up? So we're going to see if we can get a grip on this bottom edge again. Not quite enough. You can see it's moved it slightly, but we just can't get the jaws in the position we need to. So I'm just going to lift it with the bottom jaw a little bit. Try again. No. So we've exposed that smoother piece at the bottom. So we're just going to try and see if we can get a grip on that now. Difficult because we can't accommodate the whole suction tube below that ridge, so we're having to kind of move it and then get underneath again and move it, get underneath again. See if we can just jiggle this around. A little bit of gentle kind of wiggling there. Now we've got that. You can see it popped out there, so we can get a grip on our bottom section now. Really get a hold of this. Finally, it came away. You can see we've got a couple of dots of dry wax around the outside edge, so patient's still happy. We'll just whip some of those away. There we go, it's the first one. I'm just going to grab the next. There we go. And the one to the right hand side. There we are. Lovely. Eardrum looking nice and healthy. Patient much happier. So you can see this is what we removed. You see how dark some of those pieces are. Really old pieces of wax there. And this is in inches as well. Thank you very much for watching, guys.
Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already and you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.